Thank you so much, Viviana. So coming up, demand for healthcare professionals and keeping them safe. We're going to break that down with Susan Salka, CEO of hospital staffing company AMN Healthcare Services, is coming up next in today's Bottom Line. This is Bloomberg. Time now for Bottom Line. We take a look at some companies that are worth watching this morning. And today we're going to tackle the healthcare sector yet again. The coronavirus putting a strain on the medical world is not just on supplies, but in manpower, with many doctors and healthcare professionals working now around the clock. Joining us now is Susan Salka, AMN Healthcare Services, a CEO. This is your bailiwick, staffing. Can you tell us about the demand-supply dynamic within the healthcare force right now?
Good morning, Alex. Thanks so much for having me on, but even more importantly for focusing on the importance of our healthcare heroes of today. They're really the ones on the front lines here. And yes, as you can imagine, the demand for clinicians, particularly nurses, but also respiratory therapists and many kinds of advanced practice professionals are at all-time highs. In my 30 years within this business, I've never seen anything like it in terms of the rapid increase in demand, but also just the desperation and the urgency. So as you can imagine, AMN is really working hard 24/7 to deploy resources, add resources, and make sure that we can be getting the clinicians where they're needed most. It's been an interesting time for our country, but for healthcare workers in particular, it's been unprecedented.
Yes. Susan, are the workers there?
I'm sorry, can you repeat that?
Are the workers there? Do you have enough of a workforce?
You know, no, the country does not have enough if we were to see the pandemic spike at the levels that are currently being predicted all across the country. But they can move throughout the country to take their skills across state lines. And I think that's what many are actually hoping for, is that by flattening the curve, we have the ability to not only have the facility capacity and PPE, but also have the healthcare workforce that can actually take care of patients. It's really been inspiring to see healthcare workers raise their hands. You know, in some cases, folks that have been retired or maybe working part-time had maybe taken other jobs, and they want to jump back in and do whatever they can to help. Just in the last 2 weeks, as an example, you know, we put out a call to action for healthcare workers that maybe hadn't been practicing or were able to leave their current environment. And we've had almost 25,000 what we would call hand raisers who wanted to be contacted about where they could go to offer their skills and services immediately. And that's really inspiring. I mean, it's a time when many people are hunkering down and trying to keep themselves out of the line of fire of this virus, but healthcare workers went into their professions because they care about helping others. And so, you know, they're really at the front lines, you know, risking their lives for all of us.
So, Susan, there's been a lot of criticism of hospitals here in New York City in particular, and some outspoken nurses as well as doctors. There's also been reports that they're trying to be squashed in terms of them talking to the press. Do you think that structurally we're going to see a shift after this in terms of the hospital workforce if they don't feel protected by their employer?
You know, I think what we'll see is some long-lasting changes that are probably overdue. One would be around licensing, not quite the question you're asking, but it's a very important one. Right now, and historically, licensure has been controlled at a state level, and it's made it very difficult for healthcare workers to move around the country to pursue their professional, but also their personal goals. And I think out of this, we'll start to see some greater mobility and changes in licensure. What we really need is a national licensure. But I also believe that you'll see changes in the way that clinicians have a voice at the table in the administration of hospitals. It certainly has been changing over the last couple of decades, but I think this will just magnify the importance of nurses and other healthcare workers really having a seat at the table across the decisions that are made, you know, in the healthcare systems today.
And then quickly, do you think that we're going to see less people want to be healthcare workers because there weren't the right kind of precautions taken?
Yeah, I think that we'll continue to see people come to medicine because they want to help others and they want to make an impact. There's actually not been a lack of interest in going into medicine over the last decade. There's been really a bottleneck in the education systems and residency programs. So I hope what will happen is that we will see changes made to increase the capacity of residency programs. That's what's really been restricting the number of new physicians coming into practice. And then likewise, within nursing schools, we need more faculty and funding to make sure that we can train those new clinicians. So I think this will be a wake-up call. We were already in one of the worst shortages this country's ever seen for nurses and other kinds of clinicians, and it was expected to get increasingly worse over the next decade. The crisis will just amplify that, and I do hope it will be a wake-up call for the funding and resources needed.
All right, Susan, I really appreciate you taking the time today. It's a really important topic, and I'm glad we got to address it. Susan Salka, AMN Healthcare CEO, thank you very much.